All this is Dr. Mubin Sayyid from drbeen.com. Welcome to one more show. So this discussion is a quick discussion, hopefully within 5-10 minutes, and I want to present the available therapies, the ones that are approved or authorized, available therapies for anyone who may be exposed, who may have a risk of exposure, or who may be immunocompromised, and they are going to be meeting and having fun during this Christmas time, holiday season time. So I wanted to make sure that we are aware of the options available, because that is one important area where I see there is a lot of gap. And so let's start. Small discussion. I can answer your questions afterwards, but let's see if I can quickly present this therapy. Please keep it with you and give it to others as well. So first of all, disclosures none. So summary of the drugs, and interestingly, it is little. Anyways, summary of the drugs are um, number one, keep tests at home. If you have anyone at home who may need, for example, somebody who is in old age or has immunocompromise, or somebody who's at risk, or somebody who's just nervous, maybe take the at home um, tests. And for that, it is important. I'm going to show you the references as well. These references are in the description too. So here are all the references. Again, let me not take your time for the references, but these references are in the description for all drugs that I'm talking about. And there is a link in the description for FDA's page for which tests may have failed for Omicron and which tests are still fine and working. And thanks to Texas for sharing that link. Okay, back here. So have at home tests, have therapies, the therapies not have, but therapies that are available. And these are the therapies that are going to be workable for Omicron as well. And yes, some of you are going to say that, hey, why is he not talking about IVM or not others? You know that these are my default positions as well. So I just cannot say them here on YouTube. So let's not go there for the time being. Therapies, Merck's molnupiravir is very important to keep in mind. Pfizer's Paxlovid has become authorized. So not in the US, but in the EMA. In the EMA has advised to use it. So that is Pfizer. Then passive immunity of the monoclonal antibodies, AstraZeneca's antibody, GlaxoSmithKline from Britain, their antibody is actually behaving better with Omicron compared to Regenron and Lilly's. So GlaxoSmithKline's, although the problem is it is less available in the US, the GlaxoSmithKline. Regeneron's casirivimab and imdevimab, Lilly's bamlanivimab and itesivimab. These are the overall drugs that I want you to be aware of. So maybe take a screenshot of this one screen and please keep it handy. This is it. This is the important part. Now I'm just going to go over what is their indication, how are they given, and when are they given. So if somebody has no exposure, what is it that we should generally do? Of course, good hygiene, those social behaviors that are interesting and important. Whatever you believe in, please do. Whatever is right for you, do it. Healthy living includes corrected vitamin D levels, and then some other things as well. Then relax and be happy. We have done this discussion many times before. When you are relaxed and when you are happy, that reduces the production of stress hormones, and reduced stress hormone production then causes less epinephrine, which then causes better natural killer cell number and better function of the natural killer cells as well, which improves the innate arms behavior. So we should all just in general do that. Then forest bathing is important because phytoncides can actually help increase the natural killer cells as well. So if you have any parks or forests or plants near you, please go and visit these areas more often. Now, at risk population and pre-exposure, that means the population is at risk. So somebody who is at risk, maybe immunocompromised, maybe cancer, organ transplant, HIV, they are at risk, or uncontrolled diabetes mellitus, or too fragile, or old. They are at risk. If they are at risk, then there is just one therapy that is available for prophylaxis. in the EU, in the US, that has been authorized, and that is AstraZeneca's EVU Shield or Shield. It is, if you see here, it is composed of Texagevimab co-packaged with Silgavimab, and these are long-acting antibodies. They say that they can go on from 6 to 8 months for giving protection to someone who may be at risk. So this is important to keep in mind. They have an EUA in the US. So someone who is at risk is not exposed yet, and they may be exposed, and we want to make sure that they are protected. Then AstraZeneca's long acting monoclonal antibodies may be a very important thing to keep in mind. Then, at risk population post exposure prophylaxis. So, someone who is at risk and has become exposed. For example, someone who is at risk met someone who is young, and the youngster did not know that they have COVID, maybe Omicron, maybe not, and then they found out later on, and now the person is exposed. So, at risk population who is exposed but has not become positive for COVID and want to do the prophylaxis, for them, Lilly's bamlanivimab and etesevimab and Regenron. Although you would see that next in the next slides, I've made them a little red because their efficacy has dropped for Omicron. Although so far in the US yet, Delta is still more prevalent. Yes, Omicron surge is starting. Now, what happens is in next 3-4 days or by Saturday, we'll see it may be more prevalent. So keep in mind that Lilly and Regeneron's, they have polyclonal antibodies. They have 2 antibodies each in their cocktails, and they are very, very good antibodies for outpatient management, but their efficacy may be reducing. At the same time, it is also interesting to note that Omicron may be itself reducing in its intensity. Now, this is an important one for bamlanivimab, and this is on from their site. I just put that over here to remind you that you can go to their site and read it. For example, they say over here, bamlanivimab and etesevimab, this is Lilly, are investigational medicines used together in adults and children. So this is important. They are also for children who are at risk. And so you see here, treatment of mild to moderate COVID, and then they have a bunch of other things as well. Then is someone who becomes SARS-CoV-2 positive. Previous one was who is not yet positive or not yet known to be positive, but have become exposed, and we want to do a prophylaxis because they are at risk. Now, someone who has become positive, but they're still ambulatory, they're still in outpatient, they haven't ended up in the hospital with oxygen needs. So, for such folks, SARS-CoV-2 positive, SARS-CoV-2, it looks like COVID-19 might actually become COVID-21. Adults who do not require oxygen, this is EME's or Europe's medicine agency's EMA's definition of outpatient, adults who do not require oxygen and are at an increased risk of progression towards severe disease or death. Pfizer's Paxlovid, so now this is a drug. This is not monoclonal antibody. And because it is a drug and it is an antiviral drug, it is still going to be efficacious against SARS-CoV-2. Merck's Molnupiravir, again, because it is a drug, it is not a monoclonal antibody. This is actually an RDRP blocker. It would still be effective against the Omicron, and it is available. Then GlaxoSmithKline Strovimab, that has still held up against Omicron. However, the doses are really in thousands in the US. So very few doses. And they are saying they would make doses in millions by March of the next year, but that is too far away given the current situation. Regeneron is useful in this state as well, and Lilly's bamlanivimab and etesevimab. Now, please remember that for Regeneron, you will have to find a place that is near you that is injecting them, and you will have to make an appointment. So just make sure that wherever you're traveling to or wherever you are living, just see what is an area nearby in case anyone who is in your loved ones or nearby or a friend who you want to give them an idea that, hey, go there to get get therapy for yourself. Then if they're SARS-CoV-2 positive and they are adult or children, then once again, GlaxoSmithKline for at-risk children and Lilly's bamlanivimab. I feel that Regenron is also important, so Lilly and Regenron would be here. SARS-CoV-2 positive, partially vaccinated or unvaccinated or immunocompromised, or for any other reason not able to take the vaccine, or organ transplant, or chemotherapy, or immunosuppression by some other reasons. In all such cases, GlaxoSmithKline, Lilly's bamlanivimab, I kept them red to say their efficacy is reduced, and Regenron. Again, if somebody becomes sick, then molnupiravir and Paxlovid will be important therapies as well. Now, for Omicron, Lilly and Regeneron cocktails are less effective. GlaxoSmithKline antibody seems to fight better, and molnupiravir and Paxlovid sound promising still against this. Now, quick couple of more things. Paxlovid, it is given as, so this one drug, Paxlovid, has actually two drugs in it. They both are antiviral. One of them is 300 milligram, that is 150 milligram tablets of nirmatrelvir, and then 100 milligram of ritonavir. So these are the antivirals that are part of the Paxlovid, and they're given twice daily for 5 days. And molnupiravir, that is 100 milligram twice daily for 5 days. Regeneron needs infusion. So this is just molnupiravir over here. So this is the discussion. I wanted to make sure that in a few minutes, this is now 12 minutes, I could discuss this so you have something in your hand that you can share or keep handy. The very first slide is sufficient to give you the list of these things. Please be aware of them. Please know what is nearby so that if you need it or somebody loved one needs it, you can help them. And I think that we are aware of the other possibilities too. So with this, thank you very much. I am, so there's a quick question. You're very welcome, Richard. So thank you very much for being here. Please take care of yourself. Holiday seasons, Christmas, New Year, lots of vacations as well. So there is a chance of exposure, and exposure is increasing. I'm going to come on and talk about one more thing which may be concerning me. So or maybe we speak at 6 o'clock. Anyways, please like, subscribe, and share. And if you would like to support this work, there are some links in the description. You can buy me a coffee, or you can be a patron, or you can use PayPal. Thank you very much. And I would see you either soon or at 6 o'clock. Bye-bye.